As a healthcare provider, documentation is a big part of your daily activities. Sometimes it probably seems like such a big part that it overshadows everything else, making you feel caught in an endless maze of medical records. This training video provides some helpful tips on how to improve your documentation skills. Good documentation benefits both the patient and you. Your organization may be using an electronic documentation system, or you may still be using a paper record. There are positive and negative aspects to both. Bottom line, whichever system is used, the perception is if it wasn't documented, it wasn't done. Complete documentation is the key.
Let's talk about some documentation do's. When using a paper client record, do write legibly. A record cannot be a useful communication tool between disciplines if no one other than you can read your notes. Do use approved forms. These forms are generally set up to capture required information. Assessment tools and checklists, when used consistently and completed thoroughly, will provide a comprehensive picture of the patient and the care that was delivered. Do include the time and date of each entry. Electronic records will provide date and time verification, but paper records do not. When bifold and trifold forms are used, make sure to include the date on each page, in case the pages are separated at any point. It is important to provide an accurate record of the exact date and time that patients are assessed or care or treatments are provided. Do document at the time of your interaction with the patient or as soon as possible afterwards. Timely entries are recommended so that important aspects of care are not forgotten or left out of the record. Documenting while the information is fresh in your mind leads to a more complete and accurate patient record. Do sign each entry. Make sure your signature and title are legible. Each entry in the record should be accompanied by a professional signature. If initials are utilized, a signature key should be available. Do document in permanent ink. Entries made in pencil can be erased or edited without the author's knowledge. To avoid alterations in the record, all entries should be made in black or blue permanent ink. All entries in the record should clearly document the patient's condition at the time of each assessment. Each entry should include objective data to support the documentation. Whenever a patient's condition changes, the record should reflect all actions taken by the staff. The record should also show evidence of ongoing collaboration and communication between all team members. In any patient-specific documentation, written or electronic, do use descriptive terms when recording observations. Evaluations using subjective terms such as stable, doing well, improving, or appears to be losing weight should be avoided. Documentation of assessments should always include objective data and descriptions. For example, patient has stabilized as evidenced by BP up to 100/70, pulse regular and 84, respirations 16 and regular. No further complaints of chest discomfort. Do document patient behavior, especially non-compliant behavior. At times, patients have problems or bad outcomes due to their lack of compliance with the treatment plan. In these cases, it's helpful to have complete documentation of the following: initial patient and family education and training, objective documentation of failure or inability to comply with the plan of care, communication with the patient and caregiver as to why it is important to follow the prescribed plan of care, any efforts to re-educate or retrain the patient or their caregiver, communication with the physician provider and discussion of how to address non-compliant behavior at multidisciplinary team meetings. Refusal of care or specific medications or treatments should also be communicated, discussed, and documented.
While all documentation is important, there are some areas where we see incident or claim frequency, and thorough documentation becomes even more important. In a recent closed claims analysis, the top 3 claims in terms of frequency were falls, medication-related, and allegations of improper pressure ulcer and wound management. Let's look at those areas a little bit more closely. Fall assessment prevention. It is important that each patient be assessed at the time of admission regarding their potential for sustaining a fall. A fall assessment tool should be utilized so that documentation is consistent by all staff. There should be ongoing assessment of all patients at regular intervals based on changes in their status or their medications. Individualized fall prevention strategies should be initiated if the patient is identified as at risk. The patients and their families should receive education regarding the falls and prevention strategies. All of this needs to be documented, and if a patient does fall, there should be documentation of the circumstances surrounding the fall, including statements of the patient or other witnesses. Documentation should also address the actions taken in response to the fall, such as a thorough assessment, additional monitoring, or initiation of new fall prevention strategies, notification of the physician, and any required diagnostic studies. As a part of ongoing risk management and performance improvement activities, an incident report should also be completed.
The medication prescribing, ordering, and administration process is very complex, and there is a real potential for error in any one step along the way, from order to administration. Medication administration begins with a written order. If your organization does not utilize computerized physician order entry, there need to be good procedures in place for transcribing the order from the order form to a medication administration record, MAR, and notifying the pharmacy. Written orders may be unclear because they're incomplete or illegible. Faxed orders may come through blurred or unclear. Sometimes a verbal or telephone order may not come across clearly. For the patient's safety and to prevent errors, there should be a verbal order readback policy that requires the person who is receiving the information to record and then read back the complete order for verification purposes. Whenever there are any questions regarding a physician order, particularly a medication order, the order must be verified. Many medication errors occur due to problems during the transcription process. Orders should be reconciled with the MAR on a regular basis. Documentation should include the date and time-specific entries when medications are administered, the name of the individual administering the medication, clear notation as to why doses are missed or held, and the reason for and the response to PRN or as-needed medications.
Whenever a new patient is admitted, it is important to do a complete physical assessment and document any problems with skin integrity. Any wounds or ulcers should be documented on the patient record. Wound care sheets with body diagrams are very helpful for documenting this information. The documentation should address wound location, size, drainage, and odor if applicable. Pictures can be very helpful. However, when pictures are used as part of the documentation process, consent should be obtained. The record should also reflect ongoing evaluation and assessment, as well as communication with the physician for wound management and treatment orders. If a wound care specialist or team is consulted or special mattresses are utilized, this should be documented. All of these steps are particularly important when the ongoing assessment does not show signs of improvement in the wound or ulcer. Written policies and procedures related to documentation help to assure more consistent practice across the organization. Policies should address who documents, where they document, what they document, and when they document. This should be clearly communicated during the orientation process. Compliance with policy should be monitored as part of the quality improvement process. Employee performance appraisals should evaluate compliance with documentation policies. Other issues to address include the form development, approval process, retention of records, release of information, and disaster planning for health information. When you get an opportunity, pull several patient records in which you have documented notes or made entries. Ask yourself these questions. Can I read my own notes and signature? Do my notes allow me to visualize a specific patient at a given time? Or do all my notes sound the same? Are they dated and timed? Are forms filled out completely? Do my notes clearly indicate the actions that I took to resolve problems identified in the plan of care? Do my notes show that I notified other team members, including the physician, if additional action was required? Did I include the date and time of physician notification and response, if applicable? Do my notes include any feedback or orders received from those team members or physicians subsequent to notification? Would I want to have to defend my care of patient in a court of law based on my documentation?
We all get into ruts sometimes, especially with activities that seem to be so routine. Always remember that documentation is a very important part of what you do. Good documentation reflects quality patient care. Hopefully, these documentation tips will make you feel like you're back in charge and out of the seemingly endless medical record maze. Documentation is a big part of what you do, but it is not bigger than you. You can face the challenges of providing quality patient care and document that care in a way that is beneficial to both the patient and yourself.